everybody. Welcome to Special Education Thursday. We've got a really great topic for those of you who have students with autism or developmental delay or dealing with other issues in the classroom. And I'm thrilled to be talking about ABA. So we're going to be talking about understanding ABA in the classroom and who are BCBAs, because that's something that we hear a little bit about a lot when we're in special ed. And I think it'll be great to kind of get a real definition on these. Thank you for joining us. My name is Molly Whalen, and I'm the host of Special Education Thursdays, and I do these on behalf of Advocates for Justice in Education, which is the federally designated Parent Training and Information Center for the District of Columbia. It's the place where parents go who have questions for special education. And I'm really thrilled to introduce our guest for today. It's Brittany Frey, who is actually a BCBA, so she'll be able to really tell us exactly about that topic. But Brittany, to just start off, could you tell us a little bit about your background and what brought you to the work of special education and a little bit about what you're doing now?
Of course. So I am a board-certified behavior analyst, which means that I went to school and I met all the qualifications to get my certification. I've worked actually probably in almost all the school districts in the DMV. I've been in Fairfax County Public Schools, DC Public Schools, Montgomery County Public Schools. So I've kind of been all over the place. So I've worked in school systems, never been a classroom teacher, but I've supported classroom teachers. And then I've worked privately, so the medical model of ABA, which is more in-home services just with the child, which is actually what I'm doing now. So I'm no longer with school systems. I'm doing more of the in-home insurance-based ABA services.
And do you work with, I don't think I even know this, have you worked with all ages of students?
Yes. I've worked with kids, as young as, I would say, maybe 12 months, 11, 12 months, all the way to 22, 23.
Oh, terrific. Okay. All right, folks, if you're online and going along, we've got a couple of slides we're going to show you, and if I can get to the movement. So to start off, I told Brittany we're going to be really basic with this one. We're not going to get too deep. And the first question is, what is ABA? It's talked a lot about in schools and on IEPs, especially for students with autism. So tell us a little bit about how you would describe ABA, especially to parents or lay people.
Yes. I would say applied behavior analysis is really just looking at the science of human behavior. It's got a lot of fancy terminology that's thrown out there that I think makes people kind of a little weary of it or a little apprehensive to learn more, but it really is just looking at how people learn. So I would say some key aspects are really, when you think of ABA, you'll often hear antecedent behavior consequence, and that's because that's primarily what we look at when we want to teach new skills or new behaviors. So we look at what is going on in somebody's environment and the analysis between that relationship, just so we can use that information to help us produce practical change. And by practical change, I think that's one of the important parts in behavior analysis, is that we don't try to do anything fancy. We look at what is socially significant for that person, what is going to get them to be able to do more things, communicate more, whatever. And those are the changes that we want to make. So socially significant is a really, really important aspect of applied behavior analysis.
Can I interrupt for a second? Because it's a term that I've heard people use before, and I know it has to throw parents off when they hear it. But antecedent behavior, what does that mean exactly?
So antecedent behavior consequence, again, that's my apologies for using those fancy terms. So antecedent behavior consequence, so that means when you look at any behavior, and since it's a talk for parents of those with autism, I'm going to use, let's use hitting, for example. If a child is hitting and we say, okay, we need to do something to fix that, a behavior analyst is going to come in, or ABA, what it will do is say, okay, what is happening right before that behavior, the antecedent, or close in time to that behavior. And then, so those are like, what are the triggers? What's making our child hit? What's making our child cry? And then we look at, more importantly, the consequences, because behavior only happens more and more if it's reinforced, not just for kids with special needs, but typical adults. We only do things because it's been rewarded or reinforced. So we look at what happens right after that behavior to figure out, okay, what's going on immediately afterwards that's maintaining, keeping my child hitting each time these things happen.
Gotcha. So that's what, because I know, and I'm glad you use that term, because that's usually what the, related service providers and therapists use. And I think sometimes it's confusing because I always think about it in my head of like, what happened before to trigger a meltdown or to behavior. But I always, my old Latin days when I took Latin way, way, way long time ago, I know that antecedents should be happening after. So that it's like what's happening to trigger it, but then what's happening after that may serve as the reward. So
exactly.
If it's hitting and then is always taken out of the classroom and maybe to a more quiet space, it could be possibly that they're hitting every time they get upset of being too noisy in the classroom or too much. And so they're getting the reward that they want. Would that be a good example?
Yep. Okay. Yep, I think that's a great example. Yep. So we kind of look at, what is the child getting or getting out of that's keeping that behavior going.
Okay. And then tell me about with ABA, on the slide we're taking a look at, the last bullet point says it's not just for individuals with special needs. So
yes.
That.
Oh gosh, we as behavior analysts don't do a good job of getting it out there more. So because it's just the science of human behavior, so there's a ton of research related to autism and developmental delays, which is why it's kind of like a hot term. But ABA has many fields, from organizational behavior management within big companies and industries, looking at staff performance, staff motivation, staff training, to health and fitness, to addictive behavior. The principles are all the same. So what we look at is all the same, and it can be applied to anything.
And would you also apply it with other students with different kinds of disabilities other than autism? Like, let's say if a student has maybe a compulsive disorder or a emotional disability or something like that, would it be used?
You certainly can. I think one of the things to remember is sometimes these approaches are not used just alone. It sometimes can be in combination with other things, and if you can make it as simple or as complex as you want, because we have different, on the slide it says use of behavior change techniques. There are many techniques that can treat or address different types of behaviors, so you can certainly use it for beyond just kids with autism.
Okay. And then a BCBA or anybody who is practicing ABA would be taken, as we talked about, the antecedent behavior, but they'd also be thinking about maybe how the classroom was. Is it, the environment? Is it too noisy? Is it too quiet? Is it too bright? Is that a piece? Or, what happens in the classroom? So they're taking a lot of data, not just the
exactly
data, right?
Yep. Exactly. Because it's usually not just, one single moment in time. Another key aspect with behavior analysis is that we look for patterns in behavior. So oftentimes what I find is, especially in the home, a parent might say to me, oh, so-and-so had a huge meltdown today and I've never seen it before and I don't know what we should do and we need to do something to address this. And I'm pretty casual about it. I always say, okay, let's talk about it, but then let's see if it happens again, because just because it happened one time doesn't mean it's going to continue to happen. And there are many things that kind of fall under the umbrella of antecedents or what happened before a behavior that come into play. So it typically is more than just one single incident or trigger.
And it all can be something that didn't happen just weeks before. It could have been something that happened like in the morning or through their day off or something like that, right?
Yeah, so that's a little more, it's a little harder to explain in such a short period of time, and I don't want to not do it justice, but what I would say to that is there are definitely things that happen in our environment that will make other triggers be triggers for us or not be triggers for us. So for example, if I didn't eat breakfast in the morning, and then I go to work and I get busy and it's 12 o'clock and I still haven't eaten anything. And then my boss sends me an email and says, hey, Brittany, you're late on this deadline. I might be more likely to do something like, maybe slam my fist on the desk, or maybe, say something under my breath, or be irritated that they're asking me to do something because I've had this other event going on. Now, a certain behavior might be something that I kind of use to, get out of stuff or whatever. So slamming my fist on the desk might be something I normally do, but because I didn't get breakfast that morning, I might be more likely to do it when other things happen.
Okay.
Does that make sense?
Yes, absolutely. So let's move on to the next one, and we've touched on this a little bit with the specific definition, but what's a BCBA? What's a board certified behavior analysis?
So a board-certified behavior analyst has a graduate-level certificate in behavior analysis. They've completed a defined period of supervision experience. So typically it's about 1,500 hours, meaning you're working under a behavior analyst, kind of using the science and working with kids and that kind of stuff. And then after we complete our supervision hours, we have to sit for an exam, and we have to pass that exam, and then we can say that we're certified.
Okay. And then I guess I don't know this either. Do people get that at most universities have a BCBA program, or is it kind of something that's specialized?
No, they don't, unfortunately. We are lucky because George Mason has a really good program, and then we also have Chicago School of Psychology. But oftentimes you'll find people get their training or education through online courses.
And just since you've been around the block and know DC and the surrounding areas, are more BCBs kind of merging and getting into the systems, or is there like a dearth of them? Is there a great need for more?
Gosh, I really feel like we're never catching up. I feel like, each year, each month, there are kids that are recently diagnosed, and now with insurance covering services, it's just I really feel like there's a lot of need and not a lot of behavior analysts, especially with the work involved, to really effectively supervise programs or services. It's not super easy. It's not like we can have a caseload of 20 kids. A typical caseload for us is 10 kids.
Right,
so,
right. Yeah. And I'm sure also that with the, kind of with fidelity, a BCBA who's got the training is doing those things training. So let's talk about, since we are talking about special ed, let's talk about BCBAs and how they work in schools.
Yes.
You go ahead.
Oh, I'm sorry. No,
you go ahead.
I thought you were waiting for me to
No, I was waiting for you, and I was going to go, well, let me give her another prompt. But yeah, I was just like, what schools would have them? What does it look like? If a parent, sometimes parents don't always know who the adults in the rooms are. So I was just kind of like looking for that.
Yeah. So unfortunately, school systems often do not have a ton of BCBA on staff, primarily because it's not necessarily a requirement for classroom-based or school-based positions. So behavior analysts that work in schools, I would say the most common model you will see is in a school system, you've got all these classrooms for kids with autism. And then you've got this outside team of people that may or may not be behavior analysts. Typically, they have at least one on the team that go into the classroom and teach or train teachers on how to use ABA in the classroom. So it really is a consultative role.
Okay. Do BCBAs often attend IEP meetings? If like a BCBA is working with a student who, has an IEP and let's say autism or some other disability, would they attend an IEP meeting? Would they have any kind of role in creating IEP goals?
It really depends on the county or the district. I know, if it's a support role, so not a school-based position, oftentimes they keep those positions or people out of IEP meetings.
Okay.
Obviously, parents should know they can request anyone to be there at any time. So if parents feel that's important, then they certainly make that request. I know, in DC, when I worked in DC, I was a behavior analyst and I did attend IEP meetings because I had part in some of the goals and development. So again, it really just depends.
Well, and I'm going to just pause on that because I always like to repeat things for parents to make sure they hear that, because I think that's a key thing. We do try to focus on DC on these webcasts. And I think that's really important. So if you have a child with autism, or you know that ABA is being done in you have a self-contained classroom or in your school, and you want to have a BCBA at your IEP meeting, you absolutely have the right to say to the school, whichever BCBA is working, whether it's someone from the central office of DCPS or with a charter system, and you want that person to attend the IEP meeting so you can talk about the goals, you have the right to ask. So I think I'm so glad you brought that up, so that parents know, because it can be really confusing. And I think having the expert in the room when you're talking about goals around ABA and behavior is really can really make a difference. So parents, if you're listening, you can ask for that.
Yes.
And then tell me about professional development of ABA in the classroom. How have you seen that look? Because that sounds terrific.
Yeah, it's, I will say a lot of those school systems, especially DC, have really good models for what this looks like. So typically what will happen is there are certain things that they want to be present in the classrooms with autism, or classrooms that are using ABA. And so it gives the BCBAs or the support team a focus on what you want to train the teachers on, because I'm sure, as you've already picked up, ABA, we're making this basic now, but it's much more complex than this conversation. So, it really, they'll probably identify a few, key things that they want to see in the classrooms, and then that BCBA or support person goes into the classroom, and their job is to work with the teacher to teach the teacher how to use these things in the classroom. And so it's not specific to a single student, although it can be. Normally it's more of approaches for an entire classroom, and then there are always these specific students that pop up that need, further intervention or whatever, and so then the focus becomes on that kid.
That's really good to know, especially in working with schools. So that's terrific.
Yeah.
So I ask this almost of every guest, whatever topic it is what do you wish parents knew about ABA? Like, if you had a parent in a room and they were talking about ABA, what are the key things that you would really want to make sure they knew?
Yes. So my bullet points on the slide are pretty important to me, so I'm going to go based off those. So first of all, It's not magic. It's not magic. It's, we can't fix everything. We are not claiming to be able to fix anything. It's going to take time and planning, and you are not going to see changes overnight, although you might. But, we can't fix everything, but we will certainly try. So I think that's one important thing, is that just because a child is getting ABA, it's this fancy term, and everybody's making progress, and that's not realistic. So keep that in mind, that it's going to take time and planning and analysis and all of that kind of stuff. ABA, in terms of a classroom setting, is that if a parent wants to request any information at any time about the programming for their child, it should be easily shared, because some of the key components with ABA is the data collection and assessment and analysis. So, teachers or staff should be able to speak very directly and very specifically about certain things that are being targeted. Not everything, but, if you think about a child's IEP and it's in a classroom that's using ABA services, if one of the goals is, reading 50 sight words per minute, and they're using ABA to teach it, the teacher should be able to say, they started at reading 10 words a minute. Now they're up to 25 words a minute.
Wow.
You know what I mean? Like, they should be able to
Absolutely.
speak directly.
And I think that's, again, another one I'm going to stop and talk about, that it is data driven, and that's what makes it so research-based and evidence-based, and why people really, know that it works. And I think that's so key for a parent, or even for a teacher who's working with a student, or somebody who's working with a student, is that if you are doing ABA, you really should be able to have the data and be able to, be able to see the growth, even if it's small. So I think that's really great to point out, that it's data driven, and anybody working with that student should know what that data is, or be able to know what that data is.
Exactly. And then we kind of touched on this a little bit, but typically in a school system or just in general, it can be used as an approach for, a broad or large number of people or groups, such as a classroom, or just with one individual person or student.
Yeah.
And then lastly, I think this one comes up a lot. Unfortunately, unless the laws change anytime soon, you're not going to see ABA services listed as a service on a child's IEP.
Okay. Mm-hmm.
Because of I don't want to, get too much in the weeds with all the legal stuff, but, it's not a related service. It's an approach used within a classroom. So you're not going to see, Johnny gets 25 hours of pull-out for ABA services per week. You're not going to see that because they should be in a classroom that are using those teaching techniques all the time.
Now, it could be related in a goal, though, right? So it could have using ABA or this kind of data, focused on a goal, like a behavior goal or a social emotional goal. Would that be right?
I would. My safest answer is no, typically because IEPs don't list specific things or interventions or teaching procedures.
Gotcha. Okay.
I usually see it if a parent is, really wants to ensure that behavior analysis is being used and overseen. Sometimes I'll see it in like the parent comments or the notes from the meeting that might say, like ABA is going to be used to treat,
Mm-hmm.
Aggressive,
and it's certainly,
or something.
I guess also I would say, and if this is the case for parents to know, that, but then they can also talk about you want to be having, this is, intervention and evidence-based and research-based so that how are they teaching this child a social and emotional goal, especially around behavior. It can absolutely make sure that ABA or somebody who has BCBA background is part of it. So that's a really good point. Let's move. I always do this. I always start to run out of little time. So let's kind of go through how do teachers or staff work with BCBAs. I think we've touched on some of this, but maybe a few more highlights.
Yes. So when a BCBA enters a classroom, their primary focus is to go straight to the teacher because the teacher is still the lead in the classroom. And because they don't work with individual students, their goal is to teach teachers how to effectively use ABA in the classroom. So when they go into a classroom, they look at what the teacher is doing because what the teacher is doing is going to impact what the students are doing. So that's kind of how BCBAs approach or work in the classroom. And then I think another important thing is that, oftentimes schools have different procedures for, who writes a behavior plan. So, for example, one school district always has psychologists write behavior plans, but if your child's in an autism classroom, the behavior analyst might consult or collaborate with the psychologist, and they write the plan together.
Good to know.
So I think that's really, really important.
And then I know you're doing this now. Oftentimes BCBAs are also working at students' home or doing an ABA plan at home, right?
Yes, absolutely. And typically this is separate from the school. But if a behavior analyst is working in your home, what they will do is they will talk to the teachers or whoever works with your child at school to make sure that whatever's being done at home is also being done at school or vice versa, just to make sure, you aren't throwing a million different interventions at a kid. It kind of just keeps everything nice and clean and easy for the child to learn. Absolutely. And then we'll get next to resources, but one thing I probably should have made sure that either you or me said at the beginning, but and I say it one way, and I don't know if it's the absolute correct, but ABA is absolutely proven. I mean, it's been around for, I think, almost 40 years, or at least 30 to 40 years. So I think that's the other piece, is it's a very well-known, well-documented, well-researched program. And I know there's a lot of sometimes negative connotations with the ABA or sometimes uncertainty, but I think it's really important for us, especially you as a BCBA, to really emphasize the efficacy, the research behind ABA. Yeah, that's a great point. Sometimes I just assume that people people know that, and that is, we don't do as good of a job as to kind of like push that information because it's not as fun. It's a little boring to hear about, but it's important to know that it is a research-based approach. Every behavior analytic article that has ever been published in any scientific journals are always peer-reviewed. So it's backed by over 50 years of research.
Oh, wow, 50 at this point. Yeah.
And that is, and that's why insurance companies are now starting to cover these services, is because of the research within these areas. And then I think this is really important, and it's not, it's not super fun information for parents to know, but we are bound ethically to make sure that what we do at all times is research-based. So a good behavior analyst is never going to use an approach that is not proven or in the research anywhere. And I think this is a good point for parents, and we didn't get here yet, so I'm going to say it really quickly, is that yes, BCBAs work as part of a child's team. However, we run into challenges when another discipline wants to use an intervention that we know has no research to support.
Right.
And so, it's our job to kind of, we might not always say, no, we're not gonna do that. We might say, okay, you know what, you guys try it, and I'll help you collect the data on it to let you know if it works.
Well, and one of the things I've explained to people when asked, and I don't want to talk about the other things out there, is you and I both know them, and I don't want to go on online, but I usually say, some of those other things and others, what are we looking for? Practices may work with your child or may not, but we know the evidence shows that ABA absolutely will. So that's the piece that, and again, I'm glad you're saying good to that, because that's the way I try to say to parents is go with the thing that we know it has proven to work with all students like this. The one that may work great, but may not work. And then you're wasting your time on something rather than going with something that's tried and true. Exactly.
That's why I say be patient. It's not magic. It's science. It takes time. So.
Yeah. So let's get on to, we always end with Special Education Thursdays with resources and next steps. And as everyone who's listened to these sessions before knows, but I always like to repeat it, I'm a parent myself, and I have 2 kids with autism, and have gone through special ed and continue to be going through special ed. And I have gone through so many trainings along the way, and I would always leave with like this long bibliography of 50 next steps. So one of my favorite things to do with Special Ed Thursdays is say, hey, if you want to just get a little bit more, I always ask our guests to give us their top 2, no more than 5 places to go. So I asked, of course, Brittany to do this, and she's given us 4, and they're on the screen right now. But Brittany, if you could just kind of say what each of those is, and so anybody listening or on the call can go and get more information.
Absolutely. So I'll start with the easiest. I'm sure you guys have talked about this before, but I always find Rights Law is very helpful for the legal stuff behind autism in the classroom and ABA and special needs in general. So I always feel like it's very important for parents to know about Rights Law. It gives you some really easy to read information, and if anything, it kind of gets you headed in the right direction if you've got concerns about your child and their setting and their services. Then the next one is ASAT Online, Association for Science and Treatment in Autism Treatment. This is a really great article because it really talks about the evidence and science behind applied behavior analysis. And it's a lot more dry than some of the other content. But again, Molly, and you brought this up, like it's so important for parents to know the research behind behavior analysis and the efficacy of it, that this is really where that information is. So, it's helpful to at least skim through. The other resource is nationalautismcenter.org. They always stay really up to date. They've got everything from, changes in laws to changes to, school-based procedures, any new research or practices or anything that come up for individuals with autism or developmental delays. This is a really great website to kind of stay in the know. They tweet a lot of information for parents that are really dialed into their social media. So they'll, maybe post a new article that just came out from NIH or something like that. So that's a great site too. And then finally, there's an article from Autism Speaks, and it's called Applied Behavior Analysis, a Parent's Guide. And I just think this is a really easy read. I think it would be really helpful if parents kind of went through and read it, close to when they listen to us talk, our little talk, because it really kind of summarizes and puts it into some words, just what is ABA, what are the different things within ABA, what they should expect to see, and all of that kind of stuff. So I think this is a really, if parents want to read anything or look at anything, I would say take a look at the Autism Speaks article. It's about 7 pages. You can skim through it pretty quickly.
Great. Well, thank you so much, Brittany. I really appreciate it. As always
welcome.
Happens, I usually learn something new myself. And one of the reasons that I created Special Education Thursdays was to be able to ask the questions of a bunch of experts that would be able to give me a chance to ask. So thank you so much. Everybody else, we do Special Education Thursdays every other week. Our next one is going to be November 2nd, and this is a first for us. Our topic is actually going to be about what do students with disabilities think about special education and self-advocacy. And we're actually going to be joined by 2 guests, Sarah Grime, who works with School Talk, but also one of her student interns, Jeremiah Islar, who is a student with a disability and has graduated from high school and is actually working at School Talk now, and is a real powerful self-advocate as a young person with a disability. So I think it's going to be terrific to be joined by an expert, but also one of our students to learn about his experience. So Brittany, thank you so much. And everybody else.
You are very welcome.
And everybody else, all the recordings will be on the website, aje-dc.org. Just go to webinars, and then you'll see the link for Special Education Thursday. And we've got about 15 recordings so far, so we hope you enjoy. Thank you.